Good morning, everybody, and welcome to the USF Health International and Global Virus Network Global Health Conversation Series. I understand we have people from Colombia, Peru, Africa, and India. So this is a very rich audience. I'm very happy to be here. I'm Yolanda Torres, and I'm an assistant nursing professor at the University of South Florida. And I'm going to be moderating the session. I have a few housekeeping comments before we start. First of all, I want to let you all know that this session is being recorded, and the recording is going to be shared with the participants at a later time. We're going to have a question box, so you can be writing your questions along the presentation, and we're going to jump into the conversation and discussion after the presentation. So I'm going to proceed and introduce to you all, and it's my pleasure to introduce Dr. Barbara Smith. Dr. Barbara Smith is an interim director of global nursing and visiting professor at USF College of Nursing. Dr. Smith served as principal investigator of a study entitled Assessing Nurses' Risk of Exposure to Blood-Borne Pathogens in Sub-Saharan Africa. Besides, she served as a faculty member for a WHO Safe Motherhood survey in Malawi and Kenya. As both a nurse and an exercise physiologist, Dr. Smith has conducted RCTs related to chronically ill adults and children's intervention. She is currently a co-investigator on an NCI-funded exercise intervention in head and neck cancer patients following treatment. She was a technical advisor and the director of the nursing component of the University of Maryland Institute of Human Virology, President's Emergency Plan for AIDS Relief Grant, which serves 7 countries in Africa and 2 countries in the Caribbean. We provided technical assistance related to HIV, care and treatment to nurses and other healthcare workers. During her time in Africa, she served as principal investigator of a descriptive study entitled Assessing Nurses' Risk of Exposure to Blood-Borne Pathogens in Sub-Saharan Africa, and gained experience securing IRB/Ethics Committee approval in a variety of African countries. She has been an adjunct professor at universities in Africa and China. So welcome and good morning, Dr. Smith.
Good morning. Next slide. Okay. I first wanted to demonstrate the level of severity in various countries. This slide is from the Johns Hopkins Coronavirus Resource Center, and it lists the countries by the number of cases that have been detected in each of those places. For example, unfortunately, the United States leads by almost 3 times any other country in the world, followed by India, Brazil, the UK, and that. Next slide. One of the things that I wanted to cover today was risk factors for physical and mental health impacts of COVID-19 on healthcare workers. And of course, these are pretty self-evident, but working in a high-risk area is one of the major risk factors. A diagnosed family member, this seems to be one of the more problematic areas. Inadequate hygiene was another one. Suboptimal hand hygiene between patients. improper PPE use or the lack of PPE, contact with patients greater than 12 times per day, and long contact hours exceeding like 15 hours. And people may think that's a lot of contact and a lot of hours, but as we all know, nurses, physicians, and other healthcare workers are being extremely overworked in this time. Next slide, please. So some of the mental health impacts of COVID-19 on healthcare workers are listed here, starting out with anxiety and depression, but I also want to point out a few of the other ones. Marital problems, including divorce and intimate partner violence, is on the rise. Even workplace violence is an area of concern. Clinical areas, burnout, suicide, post-traumatic stress disorder, and even secondary traumatic stress disorder. You may think about some of the other instances of mental health aspect in your own countries, and that may include other things. I just received a copy of a journal, the Nursing Outlook, and it reported on the mental health consequences or the psychological impact of COVID-19 on over 4,000 Chinese nurses in the middle of the pandemic last spring and summer. Depression and anxiety were, of course, the two most common symptoms that this very large survey across multiple, I think it was 40-some sites, were the two most common. The next thing that I thought was interesting was that they reported a barrage of somatic symptoms in these people. Next slide, please. Okay. I think the big point that I'm trying to make here is that we must learn from some of the other viral epidemics that the world has experienced, from HIV, Ebola, and that SARS and MERS. Now, I know that HIV and Ebola are not thought to be airborne in any way, but SARS and MERS are, and those diseases certainly, although haven't been as widely spread out over the world, certainly have caused a lot of concern among healthcare workers, HIV, Ebola. I remember talking with a couple of my African colleagues when Ebola first kind of reared its ugly head in West Africa. And these nurses were from Nigeria, and they were scared to death in taking care of patients that arrived from those countries. So we must look at what the mental health aspects of these viral epidemics created. I was talking with a laboratory professional who had worked in the West African regions where Ebola exploded a couple of years ago, and she's still having kind of post-traumatic stress flashbacks because of her work in that area. So we studied about over 700 nurses and midwives in Sub-Saharan Africa. And the participants, when we studied them, suffered from many of the same mental health issues already identified in the COVID-19 pandemic. Intimate partner violence was similar to the population, which is rather surprising. You know, as a nurse, I many times think of myself like, why would somebody allow that to happen? And I think, you know, we really don't fully understand what kind of allows a partner to allow that kind of violence. But they also experience a fair amount of workplace violence, especially if they were exposed to risky clients, and those nurses who work more than 40 hours a week. And we know that many nurses are working far more than 40 hours a week. Next slide, please. Some of the physical impacts of COVID-19 on healthcare workers. If you just look at the cases and death, as of March of 2020, COVID-19 was reported to have caused 80,000 plus deaths, human infections, and 3,073 deaths in China. And that number included 3,000 cases among healthcare workers, okay? And that probably was only the tip of the iceberg, so to speak, in that now we're finding out that the problem was far greater since they've allowed WHO team to enter China and explore the extent of the outbreak in the Wuhan area. So there were quite a few cases among healthcare workers. In early 2020, over 15,000 healthcare workers underwent nasopharyngeal swabs. There were 139 positive tests, which was 8.8%. There was a significant difference between those who had reported symptoms and those who were asymptomatic. The strongest symptom predictors of test positivity was the taste and smell alterations, and the second leading predictor was fever. By March in Italy, there were 50 doctors who had already died from COVID-19. Next slide, please. Okay. A Canadian study, as well, they collaborated with the US in April of 2020, found that 278 physicians had died globally. The average age was about 63.7 years. The most often affected were GPs, general practitioners, and or family practice docs, and ER physicians. Pulmonologists, internal medicine had fewer, but those categories combined equaled 52% of the deaths among those 278 physicians. And the remaining group of physicians that were at risk were epidemiologists, infectious disease specialists, dentists, ENT, and ophthalmologists. And just as an aside, I had an appointment with my ophthalmologist just recently, and here in the United States, many of the frontline workers have been vaccinated. Certainly not all, but many of them had. And I was thinking, and I even said to him, I said, have you been vaccinated? And he said, no, we haven't even been contacted yet. And I'm thinking how close an ophthalmologist gets to a patient when they examine them. Of course, everybody was masked and that during my visit, but it certainly brings home the concern. The countries that reported the most physician deaths at that time were Italy, Iran, the Philippines, Indonesia, China, Spain. The US and the UK had 4% each. As a nurse, I would hope that somebody eventually will look at the cases and deaths among nurses and other healthcare workers who usually spend a significant amount of time with patients. Next slide, please. Why is the impact on healthcare workers so important? Well, I think most of you have some idea. Certainly the physical health of healthcare workers, the mental health is why it is so important to look at the impact of COVID. The social and financial health. Consider why it is important in your own country. You have different problems in your country than we do here in the US. And those may certainly impact healthcare workers differently. Next slide, please. What I think is critically important to protecting the healthcare workers is protecting the capacity of healthcare workers globally. In the US, we're acutely aware of mental health issues, including burnout among our healthcare workers. In preparation for this event today, I spoke with colleagues in low and middle income countries in Africa, South America, and Southeast Asia. And many said that they did have PPE available to them adequately, except in Africa. Many had no idea what vaccine or when the vaccine would be available. And, you know, there were a number who were waiting. They had contracts with both China and Russia, and that there's some question about how effective those vaccines are. But most of the people in these low and middle income countries had no idea when vaccine would become available. Given that these countries are low and middle income, I have concern about COVID testing and tracing, how able those countries are to support tracing and testing among healthcare workers, and the adequacy of hospitals to care for critically ill patients. And I'm thinking specifically about ventilator availability. I know that when I was working in Africa and that ventilators were extraordinarily rare. In fact, in one country, when children would come in and have to be placed on ventilators, parents were involved in the care by standing and bagging for hours, rather because the ventilator was not available. 20 to 30 years ago, morbidity and mortality associated with HIV among nurses, midwives, and healthcare workers in developing countries had a devastating impact on healthcare capacity. And there have only been spotty success stories about the ability of those countries to improve their capacity dramatically. Consider the effect of COVID-19 on capacity in low and middle income countries who have few resources for surveillance. Again, I mentioned earlier that the WHO, now being permitted to be in China, is uncovering the true extent of COVID-19 in the Wuhan area. Next slide, please. Okay, so the big thing I believe is in these low and middle income countries, limited resources, crowding at home and in hospitals, and difficult to access community groups contribute dramatically to COVID-19. I just had these two pictures because I wanted to indicate that the first one on the left is how they sterilized in one African country some of their surgical equipment. And I'm not implying that COVID-19 is transmitted, by bodily fluids, but other than droplet infections and that kind of thing. But they have very limited resources. And also, this picture on the right shows how difficult it is for some healthcare workers to access marginalized community groups. Okay, next slide, please. I wanted to show this picture of out of the Lancet 10 years ago that described basically visually the shortage of doctors and nurses and midwives on the global burden of disease. If you look at this slide, basically it's depicting the distribution of doctors, nurses, and other healthcare workers across the globe. So, for example, if you look at Africa, it looks very restricted. The US, Australia, Europe, and Russia show a robust number of doctors and nurses. Next slide, please. Compared to this slide, which shows the global burden of disease before COVID. And my question is, what will COVID-19 have? What effect will it have on this map? So you see that Africa has a very large burden of disease, and some of the other countries in South America, Russia, Eastern Europe in particular, and Indonesia also have a significant amount of the global burden of disease. Okay, and they're less likely to be able to confront and deal with something like COVID-19. Next slide, please. Okay, so I have a theory about healthcare capacity, and I call it the Smith's bucket theory related to healthcare capacity. And I'd like you to think about this for just a second. Some of you may think it's a silly comparison, but if you have a notch in a bucket, or if you have a hole in the bottom of the bucket, and that represents the loss of nurses, because you're losing, in the case of the bucket, you're losing water from the notch or from the hole in the bottom of the bucket. And it doesn't matter how fast you fill it, you can't get it quite full enough. So I want you to think about if we're having a physical or psychological impact on healthcare workers due to COVID, the capacity is limited and sometimes may be completely drained in those countries because you can't refill the bucket fast enough to keep up with the loss of capacity. We certainly don't want to go there with COVID-19. Next slide, please. So I listed some of the references that I used in preparation for this presentation, so that you might be able to take a look at those. The one thing is that a lot of the articles refer to surveys and studies that were done in the middle of 2020. So, you know, it takes a while to get articles published, and so we don't have a sense of the total breadth of issues until probably later this year. Next slide, please. So I'm going to open it up now for questions and any discussion that you might want to ask me.
Okay, thank you, Dr. Smith. That was wonderful. We have several questions in the chat box. The first question, I'm going to read them to you in order. What do you think will be the long-term impact on mental health for healthcare workers?
You know, it's difficult to say. It depends probably on the adequacy of available treatment for the mental health impact. You know, are there steps being taken to confront and deal with depression and anxiety, suicidal ideations in healthcare workers to relieve burnout? I think it's contingent upon healthcare delivery systems to consider some of the necessary treatments. There are many interventions that can be used effectively to improve resilience, and steps can be taken to identify those with severe depression and possibly suicidal ideation. I know that the U.S. was pretty shocked when a young physician in the U.S. took her own life early in the COVID pandemic. So I think it is necessary for individuals, hospitals, hospital systems, clinics, et cetera, to recognize that this certainly has a devastating impact on the mental health of some healthcare workers, especially those that are working long hours and directly with COVID-19 patients.
Thank you. Can you talk more about mental health mitigation in places with little to no mental health services?
That's a very good question and a difficult one to answer. There are some applications for computers and smartphones. And I know that the penetration of smartphones and that is pretty significant, even in low-income countries. There are some applications that help with improving resilience and that among healthcare workers. You know, there probably is not many resources, as you probably already know, that are direct treatment and counseling kinds of interventions. A number of people have talked about small group discussions among healthcare workers, talking about their feelings, et cetera. I think that would be something that would not take a lot of resources, but I do think that some of the applications, and that I know that I've seen some of the applications with regard to our soldiers coming back from Iraq and Iran and Afghanistan who've witnessed some pretty impressive wartime situations, and they seem to be relatively effective, but it is a difficult thing to answer, and I think it's imperative that countries and facilities have a conversation about that and figure out what they can afford and how it might be distributed among their healthcare workers.
Thank you. Another participant asks, are the rates of child abuse increasing at the same rate as intimate partner violence?
I did not see any articles related to child abuse, but I would speculate that it's most likely occurring at an increased rate. There are severe mental health issues with people taking care for long hours, the patients with COVID-19. So it would go kind of hand in hand with intimate partner violence, but I don't believe there's been any studies yet, at least not any large scale studies or surveys to see if that in fact is occurring.
Thank you. Another question, after seeing the impact of COVID-19 on healthcare workers, do you think people will be discouraged from joining the healthcare field? How could we combat that?
Good question. I think healthcare workers are pretty resilient, and that here in the United States, I know that the general population has been incredibly supportive of physicians and nurses and other healthcare workers that take care of patients. Those people on the so-called front lines of care. I think that in some ways balances the negative impact of COVID-19 on healthcare workers. So on one hand, you have a lot of stress and that with the healthcare workers. On the other hand, you have an incredible amount of support. If you've watched any of the large-scale networks like CNN or BBC or Al Jazeera, you've seen how countries have come out in support. I remember early on when the pandemic was devastating Italy. I remember people every day at a certain hour going to their windows and banging pots and yelling their appreciation for those who were caring for COVID-19 patients. So I think, it'll take a while for us to see if there's a dip, but I can tell you here at USF, there has been a huge increase in the number of people entering our College of Public Health and other disciplines because of the pandemic. Next question, if there are any.
I have another question here from the audience. Are there any studies about the loss of healthcare workers due to COVID in Africa or other low resource areas?
I have not seen any, and I believe that is probably related, although I have no objective evidence of that. It's probably related to the lack of surveillance, testing and follow-up of positive patients, and that is extremely limited because it's very expensive to mount adequate surveillance in low-income countries. So it's, I know that there's a number of questions about the size of the outbreak in China. WHO was just able to get a team in there most recently, and some of the initial reports say that the outbreak was significantly larger than was originally reported, and that I know that it sometimes takes quite a while for the true impact to become clear, and that there's underreporting, there's lack of reporting, et cetera. So I think that in some of the countries where you don't see as high a rate, you need to ask yourself, are they doing adequate surveillance? And if the answer is no, then you really can't tell what the impact truly is.
Thank you. Another question from the audience. What are the most effective interventions to improve the mental health of healthcare workers in this context?
I don't think there has been any study. Most of the studies have been surveys to look at what portion of those being surveyed are experiencing mental health issues such as depression, anxiety, suicidal ideation, post-traumatic stress disorder, and then of course secondary stress disorder. So I think we won't know the total picture of the impact on mental health, but I speculate that it is substantial.
Thank you. I have another question here from the audience. Guinea is now seeing a new outbreak of Ebola. How will this impact the healthcare workers given the COVID-19 pandemic?
I believe that we really need to look at some of these other viral diseases. I'm sure that it will complicate things dramatically. Although, for example, Ebola and HIV is still a problem in many low income countries. Overlay COVID-19 and it can have some disastrous consequences on the capacity, the number of healthcare workers, et cetera, in those countries. As I mentioned earlier, a colleague of mine who had worked in West Africa during the previous large Ebola outbreak was still having post-traumatic stress symptoms several years later. Now that's just one person, but I think overlaying any of these viral diseases that have a significant impact on life and limb will just complicate the impact. And if you look at what happened, for example, during the HIV epidemic in Sub-Saharan Africa, you could have seen the dramatic reduction in lifespan across these many countries that had severe outbreaks of HIV. So then you overlay, that has been slowed by programs such as PEPFAR and some of the actions of WHO and that around the world. So that has been not handled, but it's been has improved. But overlay that with COVID, and I think it certainly will be problematic.
Thank you, Dr. Smith. I'm going to ask the audience to remember they can ask all their questions on the little question section on the top of your screen. You can write your questions. I do have a question, Dr. Smith, with your experience in with global health. When do you think we will be able to see the impact of the vaccine? How long do you think it would take for us to see some light at the end of the tunnel?
Well, Dr. Fauci from the National Institutes of Health says that here in the United States, if about 70 to 85% of people get vaccinated, we should achieve herd immunity. The problem is that a number of, not just the general population, but even healthcare workers are suspicious of the vaccine. Here in this country, some of our marginalized populations also are extremely suspicious of the vaccine. So if we don't achieve herd immunity, I'm not sure how long it will be. Dr. Fauci is saying that if we achieve herd immunity, we decline in the number of cases, new cases, by the end of summer.
By the end of summer?
Yeah. But I know that when I've talked with some of my colleagues in South America, in Southeast Asia, and Africa, they haven't even received the vaccine yet, or have received only an extraordinarily limited supply. And they have received vaccines that some people are suspicious of the effectiveness of those vaccines.
Thank you. Listening to your conference, I have been thinking about the cultural impact on healthcare workers, because we are all from different countries. I'm being Hispanic, and this is in the psychological and emotional health of healthcare workers, because being Hispanic, we're huggers, kissers. We're used to that. We need that. And I'm thinking about our elderly being isolated, and the healthcare workers. Even in the good times, we are as staff nurses working when there are birthday parties, our kids are sick at home, and now during this pandemic, it's even worse.
I think we do have to look in every country, who are our marginalized populations. So here in the United States, those people of color have experienced an incredibly more significant burden of COVID-19 and that. So we really have to focus on taking care of those marginalized populations. I can tell you that some of the national effort here in the United States to distribute vaccine have now been concentrated heavily. When we move to the pharmacies delivering vaccine, they have only, the extra doses that they have sent to the pharmacies have been distributed to communities of color, so that the vaccine is now becoming available to some of our marginalized populations. But each country has to kind of, I believe, deal with the marginalized populations in their own countries. You know, I know when I was in Africa, you know, I saw different marginalized populations in different countries. They're marginalized possibly because of religion, social status, and that. So you really need to identify those populations and, you know, take steps to deal with those marginalized populations.
Thank you. I'm thinking about one of the questions of the participants about people being discouraged from joining the healthcare field. And here in the States, we have not seen a decrease of students, in the number of students.
Right.
We still have, we have been providing all the safety measures to the students, and the hospitals where they practice are letting them come in and practice with the appropriate equipment, safety equipment. So I don't know in other countries if we have seen an impact of the number of nursing students.
Yeah, at the outset of the pandemic, last spring and into early summer, a number of facilities in the US closed their doors to students. And then, so what we saw was kind of a dip in their ability to get their clinical experience. In other countries, my understanding is they recruited students to some of the hard-hit areas to kind of backfill, you know, the staff. So it varies from country to country. I know that a number of the disciplines here in the US have seen a real uptick in the number of people actually enrolling in their programs, because, you know, the country, the everyday people in the United States have been extraordinarily supportive of frontline healthcare workers, doctors, nurses, emergency technicians, anybody that has been on the so-called front lines of this has seen a real surge in support and almost reverence from the general public about because they know, you know, that they're putting their life on the line when they take care of people.
Awesome. We have 3 more questions from the audience. Sure. Is there an issue with healthcare workers being suspicious of the vaccine outside of the United States?
I can't answer that question. I know that in the United States there is some suspicion. I would imagine it's some of the lesser educated healthcare workers. I don't know that for a fact. The other thing is, in the United States, we have a problem with anti-vaxxers, they call it, and those are people, and some healthcare professionals fall into that category, that the fewer the vaccines one receives, the less likely it is that there will be issues. So I can't answer the question about how widespread it is outside the United States. I know there is some of those same issues in Europe, but in some of the low-income countries, I really can't answer the question. But I suspect that it's there.
Thank you. Another question: in the UK, healthcare workers are being offered taking support and wobble rooms so they have safe places to go during clinical shifts. Is anything similar happening in the other countries to try and support staff well-being?
I think those of you that are on the call in those countries should, in the question and answer section, indicate what's being done in some of the other countries. I do know that a number of countries are doing kind of these small groups of healthcare providers and having them at least talk about their experience and that to help allay some of the mental health impact. But I think the folks on the call are probably better at answering that question than I am. So maybe you want to put a few comments in the question and answer box.
That would be awesome. Do you see an opportunity to promote and implement advanced practice nursing into countries without this model to help alleviate the workload of our physician counterparts?
That's a thorny issue in a lot of countries. We've made some progress with advanced practice nurses getting a foothold in other countries. We have had experience for long periods of time with nurses who are trained as midwives and that. And in this country, they're certainly viewed as advanced practice nurses and that. So the other thing is some countries have actually begun to look at nurse practitioners similarly to the clinic officers and that they have about the same breadth of practice and that. So I think there is some progress, but I was asked to consult with WHO a few years ago on transforming nursing and nursing education as well as medical and education. And in a lot of countries, nurses, predominantly females, have a much lower social status. And we talked at length at the WHO about how one improves social status among nurses, and that in some of the countries. And since most advanced practice nurses do have are females, that's been an issue in some countries. But I think we're making progress. I think once some of these countries realize the impact of what it could do to help turn around the issue. I know we worked in one of the Southern African countries with the Ministry of Health to train nurses as nurse prescribers, they called them, during the height of the HIV epidemic. And that seemed to work well at the time. And that, so the other kind of thing that I can point to is the task shifting that WHO actually promoted during the HIV epidemic, where nurses were actually given tasks that were traditionally reserved for physicians only. The problem in a lot of these countries is that there's a huge need for physicians and other healthcare professionals that can deliver care. And it's not, it would be hard to force it on different countries or the ministries of health. They need to make those decisions in those countries. But
thank you. Do you know if there are WHO-PAHO guidelines on strategies to improve the mental health of healthcare workers in the pandemic?
I have been on both CDC and WHO websites, and they do have guidelines for improving the mental health impact. And I would suggest that people go on those websites and explore some of the suggestions. Some of the suggestions do not take large amounts of resources and could easily, I think, be introduced in most settings.
Well, thank you, Dr. Smith. If there are no more questions from our audience, I don't see any more questions here. We want to thank you, Dr. Smith, for being with us this morning and sharing your time and expertise. And we want to share our audience as well for being here with us. And I wish you all a very good morning.
Thank you.
Thank you. Have a good day.